So now we're going to move into a deep tissue massage, so what we would call myofascial release. So I think about Kelly's fascial system. She has a nice long fascial system that comes along the two sides of her spine. Then we also have we have a system that wraps around the front of her hips, so we know that there's a cross section as we come into her hips. So for this, I can do effleurage, but it's not really a technique that I know I'm going to change the surface. I'm calming symptoms down with that. This, I'm going to find where there's increased tension at, or maybe there's what we would call an increased myofascial bundle. A lot of our patients would say they have a knot. You're going to brace against here. You're going to use the lateral aspect of your elbow. You're going to start with your hips back and behind you, and you're going to apply a gentle force into the body before you even start moving. As you go along, you're going to gently apply more pressure into the body by just shifting your weight onto your front leg. Now, if you notice, I'm a little too far behind. I can't really move up. So I'm going to move my feet closer. I'm still in that same position, but I'm going to apply pressure to Kelly, and I'm going to ask her how much on a scale from 0 to 10 pressure am I giving you right now?
Like a 4.
Okay, like a 4. So and in my mind, that matches what I wanted to do for her. It's my first time through with this more increased pressure technique. We call it maybe the forearm technique or the elbow technique. I have to shift a little bit because as I go onto her ribs, I want to make sure that I'm on tissue and that I'm not pinching into bone. And that probably increased a little bit because I can feel more tension underneath my hands. So we're probably at like maybe a 6, right?
Yep.
And I'm going to go nice and slow because we need to allow the tissue time to actually change underneath that surface of your hand. As you reach your end destination, come back in with some of your effleurage and calm that system down. You're going to choose to do maybe 1 to 3 strong swipes, and then you might come back in with some of your easier techniques.